October is Breast Cancer Awareness Month, a great time to wear pink, support and honor current and past breast cancer patients and their loved ones. It's affected so many people. I'm joined now by Dr. Noran Barry, a breast surgical oncologist at Sharp Rees Stealy Medical Group. Doctor, thank you for being with us.
Thank you so much for having me. Such an important time.
It really is an important time to bring awareness to a lot of, obviously, what people can do, preventative care, obviously when to get checked. There are a lot of myths when it comes to breast cancer. So let's start with that if we could. What are some things you hear in your office, for example, maybe some of these myths that we want to bust out there?
Yeah, I think one of the biggest misconceptions is that you only get screening mammograms if you have a family history. And we really know that that's actually not true. So every woman starting at age 40 should get annual screening mammograms. Younger if you have, a family history or a known genetic mutation, but those are things that you need to talk to your doctor. So regardless of risk, every woman at age 40 should start.
Okay, and every year after that?
Annually.
Every year, okay. As far as when it comes to what to check for, obviously we talk about the self-breast exams. When should people be starting that?
So I think we should start that really as early as possible, so age 18, checking your breasts, looking for skin changes. All lumps don't mean cancer. Most of them are actually benign, but that doesn't matter. If you feel an unusual lump, it should always be, discussed with your doctor. So looking for skin changes, nipple discharge, changes in the shape of the breast, all things to alert the doctor.
I know we even just this morning had a story from a woman who was 33, felt a lump and was like, I don't have family history, but she thankfully got the imaging done. Tell us about that. When people are feeling something's off, how important is it that they come to doctors?
It's absolutely important. I think that's one of the biggest things actually. So if you feel something or that intuition tells you that you need to talk to your doctor, that's an important time to just speak to them and then see if there's any additional imaging that needs to be done.
Okay. For a lot of women, the type of deodorant they use, the type of bras they wear, does that impact your chance of cancer? What have you seen in your offices? Yeah,
no scientific evidence to show that can cause cancer, and so women can wear what they're comfortable with without worry.
Okay. There's no evidence that could cause any of that.
Absolutely not.
What are some of the main factors? I mean, you mentioned family history. What does that exactly mean?
So just multiple family members that have been diagnosed with breast or ovarian cancer can lead to an increased risk in breast cancer. There are a couple of other risk factors, one being alcohol consumption, so moderation is key. Not drinking every night, even small amounts, can increase your risk. And one of the most important risk factors that I think we just don't talk about enough is stress. And I'm not talking about sort of daily life stressors, but more of major life events. So important to develop some healthy coping strategies because life can be stressful.
Yeah, the stress, that is a big one I think a lot of people experience. So trying to do that self-care, really know your body. It sounds like your instincts also can help a lot. Take that in with you when you see the doctor. As you're seeing a lot of patients, I'm so curious too, are you seeing younger people that are coming to your office?
I am, and I think that, our data is kind of lagging behind our screening guidelines, and I think probably in the next 5 to 10 years, the screening age will drop to 35.
Oh, wow.
But for now, it hasn't caught up yet.
Okay.
So 40 is the time when you're at average risk. But if you know that you have a family history, talk to your OBGYN, talk to your primary care physician, and we have these risk assessment tools. So at age 25, if you have a greater risk, then we can add MRIs.
Okay, and that's just not just your mother, for example, but anyone in your family. Know what their history is.
Absolutely.
Okay, is there a good resource people can go to?
Your doctor. I think that's the best.
All right.
Yeah. Developing that relationship and knowing your body, exactly as you said.
Okay. Thank you very much, Dr. Barry, for being with us today.
My pleasure.
Great to see you. We'll be right back after a quick break. Keep it here.